Welcome to Holmes on Health, a podcast where nutrition, fitness, and hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies to help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello, and welcome to this episode of Holmes on Health. This is episode 10, and I'm Dr. Alan Holmes. I just want to take a second and shamelessly pat myself on the back. I heard recently that only 4% of podcasts make it 10 episodes, and this is episode 10. My goal is that this is just the first 10 of many, many episodes to come. I am passionate about these topics that I'm discussing, and I sincerely appreciate those of you that have taken the time to listen in. It really means a lot to me. Today, we're going to dive deep into one of the most misunderstood and underdiagnosed conditions affecting women worldwide. We're going to be talking about Polycystic Ovarian Syndrome, or PCOS. Here's a startling statistic just to get us started. Up to 70% of women with PCOS don't even know they have it. The statistics vary between 6 and 13%, all the way up to 20% of women are affected by it. That's nearly 65 million women, according to 2021 data. So, why are so many women walking around undiagnosed? And more importantly, what can we do about that? Today, we're going to unpack the science, we're going to bust a few myths, and we're going to give you the tools you need to advocate for yourself and those that you love. So, let's start with the basics. Despite the name, Polycystic Ovarian Syndrome, PCOS, it's not just about ovarian cyst. In fact, you can be diagnosed with PCOS without even having an ovarian cyst. This is one of the biggest misconceptions. Some studies suggest that up to 50% of women with PCOS have never had a documented ovarian cyst. PCOS is actually a complex endocrine disorder, meaning it affects the hormone system. The technical diagnostic criteria is having at least 2 of the 3 key features here. The first is chronic anovulation, meaning you don't ovulate regularly. The second is hyperandrogenism, meaning excessive male hormone. The third is polycystic ovaries seen on ultrasound. But here's where it starts getting interesting, at least from a scientific standpoint. The driving force behind PCOS isn't actually the ovaries, it's insulin resistance. Here's how it works. When your tissues become resistant to insulin, your pancreas has to compensate by producing more and more insulin. Insulin resistance lowers sex hormone binding globulin, primarily by increasing levels of pro-inflammatory cytokines, thereby decreasing the amount of sex hormone binding globulin expressed and produced. In addition to that, hyperinsulinemia, meaning too much insulin, is also associated with insulin resistance that can directly inhibit sex hormone binding globulin secretion from the liver. So, low sex hormone binding globulin means that less of the total testosterone gets bound up, which means there is an increase in the amount of free testosterone. These high androgen or testosterone levels then impair normal follicle development and ovulation. This leads to irregular periods, infertility, and symptoms like excessive hair growth, acne, just to name a few. It's a vicious cycle that affects not just reproduction, it affects the entire metabolic system. So, if PCOS affects up to 1 in 5 women, why are so many cases missed? Well, there's several factors to this, and understanding them is going to be crucial for you, the patient, who matters, to get proper care. First, there's no single blood test for PCOS. Diagnosis is a clinical judgment, and it requires ruling out other conditions that could be causing similar symptoms. This means your healthcare provider is going to need to be knowledgeable about PCOS, and they're going to be willing to do the detective work. Second, symptoms vary widely and often overlap with other issues or symptoms where society may say, well, that's just normal, meaning that's just a normal teenager or young adult. Irregular periods, you're young, it'll regulate eventually. You have acne, it's just part of growing up. You have weight gain, maybe you should just go on a diet. Too often women are actually just dismissed when they should be undergoing a thorough evaluation. The third thing is this, and this is a big one. There's an awareness gap amongst clinicians. Many healthcare providers simply were just never trained to recognize PCOS. The other confounder is that because the name PCOS has ovary in it, it is assumed it is a gynecological problem. But as we just explained, it's actually an endocrine problem. So the gynecologists don't really claim it. The endocrinologists sometimes don't claim it either because it has the word ovary in it and they think it's a gynecology problem. And these ladies get missed. The presentation varies widely as well. Some women, as we mentioned, have ovarian cyst. Some women don't. Some women do present with the classic picture. Their periods that are regular or completely gone. They have excessive facial hair. They have weight gain. But others are a lot more subtle than that. Some of them actually have completely normal periods. No issues with fertility. Some are thin. Even up to 30% of diagnosed women with PCOS are of normal weight. Some do have obvious cysts on ultrasounds. And as we mentioned, some don't. There's also the unfortunate element of social stigma. Many women don't want to report that they're having issues with embarrassing hair growth on their face or their back or their chest. Or they've just come to normalize that their periods are wildly irregular and no one's ever talked to them about what a normal menstrual cycle should be like. So next, I want to talk about what PCOS actually looks like, because if we can recognize it, we are one step closer to getting help. The most common symptoms, again, irregular or absent periods. This meaning greater than 35 days, or maybe it's fewer than 8 cycles per year. There's no hard and fast rules to this. There's hirsutism, fancy word for excessive hair growth in male pattern areas like the face, chest, and back. Persistent acne that doesn't respond well to typical treatments. This is another red flag. Some women experience male pattern hair loss or thinning of hair on the scalp. Many women with PCOS struggle with weight gain, especially around the midsection, and they find it extremely difficult to lose weight despite their very best efforts. Many women experience mood issues, including anxiety, depression, and body image concerns, which, when we think about how erratic the hormone levels are, this should not be surprising. For women trying to conceive, PCOS is a leading cause of infertility due to irregular or absent ovulation. But to be honest, the effects go far beyond just reproduction. Let's talk for a minute about the long-term health implications of PCOS, and these should be taken very seriously. Women with PCOS have a 4 to 5 times higher risk of developing type 2 diabetes. They have a 1.5 to 2 times greater risk of cardiovascular disease, meaning heart attacks and strokes, a 1 to 3 times increased risk of breast cancer, and a 10 times, by one study, up to 17 times higher risk of endometrial cancer later in life. Now, this isn't meant to scare you, but to emphasize why early recognition and treatment matters so much. So to dive a bit deeper, you may be asking, well, why does it increase cancer? Well, here's why. If a woman doesn't ovulate, then they never create a corpus luteum, which is a temporary gland formed in the ovary after release of a mature egg. It's the corpus luteum that produces progesterone. So no ovulation, no corpus luteum. No corpus luteum, no progesterone. Progesterone opposes estradiol. That's how it's supposed to work. It lowers cell division in the endometrium, and it lowers cancer cell growth. So if you have no progesterone, you have an imbalance of excessive estradiol that can lead to excessive endometrial cell lining growth and ultimately cancer. So I get it. That sounds kind of dismal, if not just outright scary. Fortunately, we don't have to be in complete despair because there are very effective ways to treat PCOS. So let's get into them. Lifestyle modification is the gold standard, first-line treatment for PCOS. And I'm not just talking about generic, eat less, move more type advice. We're going to go into some evidence-based interventions that's supported in the literature that can literally restore ovulation and normalize hormone levels. The research shows that even a 5 to 7% reduction in body weight can restore menstrual regularity and improve fertility. So I guess you're saying, well, what kind of diet should I go on? That's an important question. Women with PCOS do well on a low-carb diet. Why is that? Because insulin resistance can be thought of as your body not efficiently processing carbs. So here's how it works. When you eat a carb, your body turns those carbohydrates into glucose. Then insulin is required from the pancreas to transport the glucose across the cell wall into the cell so that it can get burned for energy by the mitochondria. If the cells are resistant to insulin, then an increased amount of insulin is required. This is called, again, hyperinsulinemia. The insulin hormone also is the hormone that tells your body to store fat, and it tells your body to not burn fat. So a low-carb diet leads to a decreased glucose production, which leads to less insulin being required. This leads to improved insulin sensitivity at the cellular level. Specifically, we want to avoid processed carbohydrates and processed foods in general. Why? Because they tend to cause a higher or a more potent insulin response, and they are also very inflammatory. Some women benefit from intermittent fasting. Now, I do not recommend all women with PCOS start intermittent fasting. Younger ones tend to do better once you've reached 30s, 40s, perimenopause, menopause. Oftentimes, the intermittent fasting can do more harm than good as related to your hormone balance. Specifically, can cause increase in cortisol levels, which in and of itself can cause insulin resistance. The reason for younger women intermittent fasting can play a role is because extended periods of hours without eating are hours that we didn't need insulin. Again, the name of the game is to lower the insulin levels so that we can reverse the insulin resistance. Let's move on to exercise. When we think about exercise in PCOS, we recommend two avenues. The first is aerobic exercise. For this, women are going to benefit most greatly from what I call conversational cardio, meaning if you were on the telephone and you were exercising, the person you were talking to would recognize that you were exercising. However, you would still be able to complete sentences, meaning you're not going so hard you're completely out of breath. Chronic high-intensity cardio, those workouts, think Orange Theory boot camps where you're going 80, 85% for extended periods of time, that can actually cause further stress on the body that is already stressed because of the PCOS itself. It can lead to an increase in cortisol levels, which can actually just make things all worse. Now, if you want to go hard, 1 or 2 sessions a week of all out, meaning 100% high intensity cardio, can be beneficial. These workouts should probably be no more than 5 to 8 minutes, maybe 10 minutes if you're in really, really good shape, if you're doing it properly. Meaning if you're going all out in these interval type efforts, you're only going to be able to do so many of them. The second piece of exercise, resistance training. Heavy weightlifting has been shown to improve symptoms of PCOS. And this is because weight training has been shown in multiple studies to make the cells more sensitive to insulin. Again, we are trying to reverse insulin resistance. A few other thoughts. Stress management, yoga, meditation, mindful breathing, other supportive routines that may help maintain hormone balance are super important for the patient with PCOS. Supplements. I don't get crazy here, but I do recommend that you optimize magnesium, vitamin D, and B12 if you're a PCOS patient. So what else is there? What if we're lifting heavy weights, we're walking and getting our 10,000 steps in, we've cleaned up our diet, things are better, but there's still a lot of symptoms happening? What are our other options when it comes to pharmaceuticals or medications? Well, fortunately, there are several. Metformin can help regulate insulin and can help with ovulation and those with metabolic complications. The newer GLP-1 medications like semaglutide and tirzepatide can be a game changer for PCOS patients. Why is this? It's twofold. One, it helps regulate insulin. Secondly, it helps with weight loss. And as we mentioned, a 5 to 7% reduction in weight can improve ovulation and fertility. Spironolactone. For those women with PCOS that suffer from excessive facial hair, chest hair, back pain, acne, even thinning hair on the scalp, spironolactone can be very beneficial. It is traditionally thought of as a mild blood pressure medication or mild diuretic. However, it also blocks androgen receptors, male hormone receptors, and that's why it is effective in treating the symptoms that are being caused by elevated testosterone levels. Let's talk about progesterone. When I say progesterone, I'm not talking about the synthetic progestins that are in birth control. I am talking about natural, micronized, bioidentical progesterone. It can be very effective in treating many of the symptoms of PCOS. For those women with PCOS that have very heavy periods or severe PMS symptoms, progesterone can be a game changer. Progesterone is also critically important in maintaining pregnancy. When a woman has PCOS, they have as much as a 40% chance of having a miscarriage due to the lack of progesterone, making it really important for these women to take natural progesterone throughout the pregnancy to prevent the miscarriage and prevent premature deliveries. Another thought is cancer. Because women with PCOS don't produce enough progesterone often, they are at increased risk of breast cancer and endometrial cancer, as we discussed earlier. So progesterone can actually have an anti-cancer effect and should be considered just for that. Finally, thyroid. And you may be wondering, what is the thyroid got to do with polycystic ovarian syndrome? Many women with PCOS are thyroid resistant. So their thyroid labs may be normal, but there is not a sufficient amount of thyroid lab because the cells are not using it efficiently. This is called tertiary hypothyroidism, meaning at a cellular level, the cells are resistant to thyroid hormone. Now, thyroid hormone plays a role in metabolic health, meaning metabolism, and it also reduces insulin resistance. So optimizing thyroid hormone levels can be critical for a woman with PCOS when it comes to weight management, energy, insulin resistance, just to name a few. So the key to PCOS management is that it should be recognized that it's most effective when it's a multidimensional approach, meaning we want to address diet plus exercise plus medications. We want to address the insulin resistance, which is the underlying problem. We want to address the irregular cycles. We want to address the acne and the facial hair issues. We also want to address the fertility issues. And let us not forget, based on those staggering numbers I gave you earlier, we absolutely want to prevent chronic disease where we can. So what can you do with all of this information? Well, whether you've been listening to this because you suspect you might have PCOS, or you're listening to this because you may know a friend or a loved one that has PCOS, here are a few action steps. The first, track your symptoms. Keep a menstrual cycle diary. Note any excessive hair growth or persistent acne. Note your weight changes. Are you consistently gaining weight without another explanation? As well as your mood patterns. This information can be invaluable when you meet with a healthcare provider or hormone expert. If you have 2 or more of the signs that we discussed, you should seek an evaluation. I would say that if you have just one of them, it's still worth the conversation with an expert. Don't let anyone dismiss your symptoms as normal if they're interfering with your life and your well-being. When you do seek care, be prepared to advocate for yourself. Ask specifically about PCOS evaluation. Here's the test I recommend: a metabolic panel, a hemoglobin A1C, a fasting insulin level, a lipid panel, a full hormone panel, including FSH, LH, total and free testosterone, estradiol, progesterone, sex hormone binding globulin, and a complete thyroid panel. If your provider seems unfamiliar with PCOS or hesitant to really do the investigative work and track down whether or not you have PCOS, you shouldn't hesitate to seek a second opinion. I would recommend a hormone specialist. I highly recommend one trained by WorldLink Medical. It's where I did my hormone training. They are excellent at all things hormone. They are excellent at PCOS. Remember, you know your body better than anyone else. If something doesn't feel right, trust that instinct. The medical community is getting better at recognizing PCOS, but we still got a lot of work to do. So for those already diagnosed, know that your journey is unique. Because there are so many variable symptoms, what works for one person with PCOS may or may not work for you. And that's okay. Just be patient with yourself and your healthcare team, as we should be working to seek what is the best approach for your specific situation. In conclusion, PCOS might be common, but it doesn't have to be a life sentence of frustration with symptoms that go unaddressed and unresolved. With proper recognition, evidence-based treatments, a hormone expert, women with PCOS can live healthy, fulfilling lives. Here's the key takeaways. PCOS is a complex endocrine disorder that's driven primarily by insulin resistance. It affects far more women than we realize. In many cases, go undiagnosed due to the variable symptoms and the lack of awareness. But if properly diagnosed and recognized, we do have excellent treatment options that start with lifestyle modifications that can include medication when necessary and can be genuinely life-changing. If today's episode resonated with you, please share it with someone you think it might benefit from it. And remember, advocating for your health isn't being pushy or demanding. It's necessary. Until next time, live life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice. And no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have.
and should seek the assistance of their healthcare professionals for any such conditions.